For the cranial bones, we have the coronal or frontal bone. We have the left and right parietal bones. We have the occipital bone that has the external occipital protuberance. The ligamentum nuchae is anchored here, and it helps support the weight of the head and helps stabilize the neck. We have the temporal bone. Here's the squamous area of the squamous part of the temporal bone. We have the exterior acoustic meatus. We have the mastoid process. We have the temporal mandibular joint and the styloid process, which would be coming out from here. Interiorly, we have the petrous, and it means rocky, and it houses the middle and internal ear cavities. We have the internal acoustic meatus, and the cranial nerves 7 and 8 pass through this opening. For the sphenoid bone, we have the greater wing. This goes within the left orbital area. We have the superior orbital fissure, which is a fissure that runs in the back of the orbit, and it houses the cranial nerves 3, 4, and 6. They control eye movement. We also have the lesser wing of the sphenoid bone and the greater wing. We also have the internal optic canal and the sella turcica. The optic canals have the cranial nerves 2 and ophthalmic arteries passing through, and the pituitary gland sits in the hypophyseal fossa of the sella turcica. Now we have the ethmoid bone. It sits behind the nasal bone. Part of the ethmoid bone is the cribriform plates. It's the superior surface of the ethmoid bone, helps form the roof of the nasal cavities. It is perforated with foramina to allow the passage of olfactory nerve filaments, which pass the message from the smell receptors in the nasal cavities to the brain. Then we have the crista galli, which means rooster comb. It's the top point of the ethmoid bone. It's a thick triangular process at the superior portion of the ethmoid bone. The dura mater, which is the outermost covering of the brain, attaches to the crista galli. For sutures, we have the coronal suture, which is in between the coronal or frontal bone and the left and right parietal bone. We have the sagittal suture, which lies in between the left and right parietal bone. We have the lambdoid suture, which is in between the left and right parietal bones and the occipital bone. We have the squamous suture, which is in between the temporal and greater wing of the sphenoid bone. For facial bones, we have the maxilla, which is the upper jawbone. We have the alveolar processes, which are the sockets for the teeth. We have the zygomatic process, which is part of the cheekbones. We have the temporal process and the zygomatic process. We have the nasal septum, and the two bones that make up the nasal septum are the vomer, and the perpendicular plate of the ethmoid bone. The inferior nasal concha is a thin scroll-like bone in the nasal cavity, and it lies below the ethmoid bone and above the maxillary bone. They help form a part of the lateral walls of the nasal cavity. The curved nature of the bones causes the air entering the nose to circulate, warm, and moisten before the air enters the lungs. For the mandible, we have the mandibular condyle, we have the mandibular notch, the coronoid process, the ramus, the mandibular body, and the mandibular angle. That's done. Vertebral column, there are 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae. There are 5 fused vertebrae in the sacrum and 4 fused vertebrae in the coccyx. For C1, the first vertebrae of the cervical column, it is called the atlas. It has no bony or spinous process, and it allows one to nod, to say yes. The second vertebrae, C2, is called the axis, and it's just like the other vertebrae, except for a knob-like dens projecting superiorly from its body on the anterior portion of the vertebrae, and the dens acts like a pivot and allows rotation of the atlas. So it allows one to go no. For thoracic vertebrae, these are the spinous process, these are the transverse process. The body of the vertebrae is on the inside. So it looks like this. This is the body, and this is the intervertebral foramen, and that would be within the vertebral column. The spinal cord passes through the intervertebral foramen throughout the whole spine. The cervical and the lumbar spine have triangular intervertebral foramen, and the thoracic has a circular one. You can see the difference here. This would be like the cervical or lumbar, and the round one would be the thoracic. The natural curvature of the spine gives the spine strength, helps the person to walk upright, and also acts as a shock absorber. The C1 through 7 is concave. The thoracic T1 through 12 is convex. The lumbar 1 through 5 is concave, and the coccyx and sacrum are convex. Problems with the spine can occur with scoliosis, which is an unnatural curvature of the spine going side to side. If a person suffers from lordosis, that is an exaggerated curvature of the lumbar spine, which makes the person look like they're swayback. And for if a person is kyphotic, that means it's an unnatural curvature of thoracic spine, and it makes the person look like they're humpback. The last part of the axial skeleton is the sternum and the ribs. There's the sternum. This is the jugular notch. This is the manubrium. This is the sternum body. And the xiphoid process. True ribs are the ribs that are actually attached to the sternum. False ribs are ribs that are attached via cartilage to the true ribs. And floating ribs are ribs that are not attached to any other ribs but are attached merely to the vertebrae.